Hello, I'm Dr. Sama Sheikh, and today I will be talking about contraception and how to take a history as well as counsel your patients. This will be useful for OSCE examinations as well as in real life when you have patients that are seeking contraception. So before you enter the room, you should always knock on the door. And when you enter, you should introduce yourself to the patient. So you can say, "Hello, Miss Smith. I'm Dr. Sheikh. I'm one of the doctors on duty today. Nice to meet you." And then you should tell them that, as I understand, you're here to seek some contraception. And I would like to ask you a few questions about your understanding for contraception and just gather some information and some history from you so that we can best determine which contraceptive method is the best for you. I would also like to assure you that whatever we discuss today is confidential and between me and you, and nothing will be disclosed until and unless required by law. It's important to give confidentiality, especially to teenage girls who may be there at your clinic and they may be hesitant to speak to you about contraceptives. And that would be because they may not want to tell their parents or other people around them about this. And it's important that you, as their physician, maintain that confidentiality. And then you can ask more questions such as, is this your first time seeking contraception? And if not, have you used any previous contraception? How was your experience with it? Why did you stop? Or why do you want to change to another form of contraception? And then once you've gauged that initial encounter, you can move on to taking the menstrual history from your patient. So next you would move on to the menstrual history, and in the menstrual history you would want to establish the LMP, which is the last menstrual period. So you would ask your patient, when was the first day of your last menstrual period, and is it regular or not? And ask them, is there any chance that you could be pregnant? And if they think that there is a chance that they could be pregnant, then ask them, when did the episode of unprotected sex happen? That will help you determine whether they fit into, whether they can take any emergency contraception and what would be the best form of emergency contraception that they could take. And then also ask them whether it was a consensual episode or not, because oftentimes you have victims of sexual abuse who come to your clinic, and you should be there for them for that, and you should know what services to offer them if they are victims of sexual abuse. And then you can ask about certain pregnancy symptoms. For example, do you feel any breast engorgement? Have you been going more frequently to the bathroom? Ask them more questions about their menstrual history. For example, how long does your cycle last? Is it every 28 to 32 days? Do you have any spotting in between your periods? How is your bleeding? If they have any heavy bleeding, ask them, how many pads do you use? And also ask whether there has been any pain during periods or not. And then you move on to the sexual history, and you can use a transitionary sentence like, I will be asking you some personal questions. If you don't mind, it is solely for the history, and I assure you full confidentiality, and nothing will be disclosed until and unless required by law. And then ask them, whom do you live with? How long have you been in a relationship for? How many partners do you have? What type of sexual activity do you engage in? What about your partner? And ask them, when did you first start sexual activity? Ask them whether there was any abuse, how was their relationship with their partner, whether their partner is experiencing any discharge or any symptoms like burning urination. And that is essentially the questions that you would ask for the sexual history. So for the gynecological history, you should ask your patient, when was your last pap smear? And what was the result of the pap smear? And ask them, have you ever been screened for any sexually transmitted infections? What about HIV? And you can ask this in a polite way by saying that, just for the purpose of this history, I'd like to know whether you've ever been screened for any sexually transmitted infections. Then ask them, have you noticed any vaginal discharge, any sores or lesions in the labial area? Have you ever been diagnosed with pelvic inflammatory disease? You can ask them for some UTI symptoms, like have you noticed any burning, urination, or changes in your urine? Then ask them, have you ever received the HPV vaccination? And those are essentially the questions that you would ask for the gynecological history. And then you'd move on to the obstetrical history, and in that you would ask them, have you ever been pregnant before? And ask them if they ever had any abortions or miscarriages. How many children have they delivered? If there's more than 2, ask them if any of them are twins. Ask them about each pregnancy, whether it's been vaginal or C-section, whether there was any instrumentation used or not, any complications during their pregnancy, was it full term or not? And for any recent pregnancies or deliveries, ask them whether they're still breastfeeding or not, because that will also determine what form of contraception they would use. And ask them, do you intend on getting pregnant again? And if they do, when do they want to get pregnant again? Because there are some long-term contraceptives and then there are some shorter-term contraceptives. So you would be able to help them with that too. So once you're done with the obstetrical history, you can move on to the next section. So in the next section, I usually do a quick screen of constitutional symptoms. So I ask whether there are any fever, weight changes, and in particularly for the contraceptive, I ask about liver disease. So I would ask, have you ever noticed any yellowish discoloration of your skin or eyes? And then I do the SAD, which is the smoking, alcohol, and drugs. So ask them, do you smoke? Have you ever smoked? If they do smoke, how many cigarettes do they smoke, and for how many years do they smoke? Then ask them about alcohol, how many drinks they have, how often do they have, what do they drink, and ask about drugs. Do they take any recreational drugs? And if they do, then ask them about what they take, what route they take those drugs in, and then ask about other ones if relevant. Once you're done with that, you would move on to the past medical history. And this is also a very important part of taking a contraceptive history. So next is the past medical history section, and this is also a very important section because here you really need to find out whether the patient has any contraindications that can prevent her from taking certain forms of contraceptives. So you should ask the patient, have you ever been diagnosed with cancer before, in particularly breast or any gynecological cancers? And if the lady is over 40 years of age, ask her, have you ever had a mammogram done before? Then you can ask some screening questions for coronary artery disease. Ask them, have you ever been diagnosed with high blood pressure? If she has, you should ask her about whether it's controlled or not. Ask her about blood sugar, lipids. Have you ever had your cholesterol levels checked? Then do a DVT screen. Ask them, have you ever been diagnosed with any thromboembolic disease? Do you have a propensity for your blood to clot easily? Then ask questions about depression as well. Have you ever been diagnosed with depression or any mood disorder? Ask about liver screening symptoms. Do you have any active liver disease, or have you been diagnosed with any liver disease? Once you're done with that, you can ask them about the medications. Are you taking any medications? And if they are, what are they taking? And how long have they been taking that for? What are they taking the medications for? Oftentimes you have medications that interact with OCPs, like antibiotics can interact with the contraceptives as well. So you should know what medication the patient is taking. And also, for example, there are certain medications, right, like retinoic acid, where you will have to put the patient on double contraceptives. So it's important to know what medications the patient is taking and whether they are on the right contraceptive as well. Then you should ask whether the patient has any allergies, and that's a really important question as well, because you will be prescribing, and it's important to know whether your patient has any allergies or not. Once you're done with that, you will move on to the family history, and in the family history you can ask about any history of breast cancer, any gynecological cancers in the family, any history of any clotting disorders in the family, and or you can just ask them, how is the overall health of your parents and your close family members, and if there's anything of concern, please do mention that to me. And then you would move on to the social history, and then you can ask her, what do you do for a living? You need to rule out if there's any sex trade happening, and if there is, then of course you would give the appropriate contraceptive advice for that as well. And you should ask them whether they are happy in their relationship, if there's any stress or not. You're the family physician, so it's often they may not have anyone else to talk to besides you, so it's important for them to have that confidence in you and the fact that you're there to help them and give them resources to places where they can seek help, if at all. So once you've gathered all that information, you have a good idea of what form of contraceptive advice you can give your patient, and then you would start with the counselling. And then you move on to the counselling part, and you can ask, if you haven't already, about what the patient knows about contraceptives and how much they would like to know, and whether or not they would like to know about any certain form of contraceptives. So you can start by defining what contraception is, and you can start by saying that contraception is an umbrella term used to describe the techniques and methods to prevent fertilization. You've got hormonal methods such as the oral contraceptive pills, implants, and injections. Then you've got the intrauterine devices. You've got barrier methods such as condoms and diaphragms. Then you've got behavioral methods, and you've got more permanent methods like sterilization. So that's a nice way to start, by just giving an overall, a view of the different forms of contraception, and then you can go into more detail. So let's go into more detail about oral contraceptive pills, and then you can read about different forms like the IUD, and similarly talk about the other forms of contraceptives. So starting with the oral contraceptive pills, you've got the combined estrogen and progesterone formulation, and you've got the progesterone-only pills. They work by preventing ovulation and increasing the thickness of cervical secretions. It's important that you take the pill every day and are compliant with taking the pill, so you should ask your patient, are you a good pill taker or not? And then say that there are certain contraindications to taking the oral contraceptive pills. For example, any undiagnosed vaginal bleeding, any personal or family history of breast or gynecological cancers, any active liver disease, any migraines with aura, if the patient has heart disease, or uncontrolled blood pressure, if the patient has any migraines with aura, if the patient is a smoker whose age is greater than 35 years of age. These are certain contraindications for taking the OCP. Ask your patient, do you have any questions up until now? And then tell them that there are many benefits as well to taking the OCP. It helps regulate your periods, it reduces anemia, it reduces period pain, it reduces the risk of certain cancers such as ovarian and uterine cancers. It reduces the incidence of benign breast lesions as well, and it has a very low failure rate. You should also mention the side effects that are there with oral contraceptives. So you should say that there are certain side effects as well. Oral contraceptive pills do not prevent sexually transmitted infections, so it's important that you continue to use condoms to protect yourself from sexually transmitted infections. There are also other side effects such as weight gain, transient breast tenderness, you can have headaches, you can have vomiting and gastrointestinal discomfort as well. Then you will tell your patient your plan. So you will tell the patient, we will do a pap smear if the patient hasn't already had one done yet, and that you will do a physical examination, you will document the patient's blood pressure, and you will provide the patient with brochures and reading materials, and you will book an appointment for the patient to come in for a follow-up. You will give the patient a prescription for the pills. You would also do a urine screen for gonorrhea and chlamydia. Then you will give the patient pills. You will tell them to keep it somewhere where they will remember to take it at the same time every day. If they